to meet you.
Hi, Dirk.
And
Great to meet you too.
yeah, I'm looking forward to that interview. And I think let's start right away, maybe with a short introduction before we go into this hot topic. And yeah, my name is Dirk Reuter. I'm CEO of Reuter Medical. We're a consulting company with specialization on medtech, pharma, and life science companies. And as you know, you're partner of MedHubAI. So, Bence, up to you.
We met on LinkedIn with Dirk, and since then we closed a partnership, and we are tackling the burning problems of healthcare. I'm originally a designer, and I'm also a developer now with agentic AI methods, and I'm focusing totally on customer service and patient and doctor communication with our startup MedHubAI.
I have 20 years of experience in medtech, pharma, and life sciences, and now running my own company with valued partners, more than 40 partners worldwide from different countries, with a real specialization on medtech, pharma, and life sciences. And yeah, looking forward to this interview.
I look forward to, and it's an honor to do this partnership with yourself with such a deep experience in the health tech industry. I'm originally a designer, and then I became a developer as well with the agentic tools, which is a very nice marriage between healthcare and technology. And healthcare industry globally is at a pivotal point, at an inflection point now.
Yeah, likewise. Thank you, Bence. We are honored at Reuter Medical to be working with you. Because you're already doing great stuff in the field of AI and digital automation. And yeah, I was really astonished also, and really happy to learn about the project that you have already done with clinics and in the healthcare field. So yeah, looking forward to that partnership. So, Bence, I would like to start with a short question up front. I mean, I've been talking with a lot of people on AI and the usage, the applications in different countries.
Yeah.
And it's quite stunning when you talk with people in the Middle East or India, then again, maybe in Germany or somewhere else. There is huge differences. How do you see that? Where do we stand today in Europe?
In Europe, I see it as a positive thing, the regulation. Everybody's complaining about Europe, that it's too strict and, it's stifling innovation. But I would like to approach it as an advantage. So if you develop a software or a system or a workflow in Europe, then you can export it and you can stand out in the global market, because you can be sure that it's all the patient data, private data is in safe hands. And you can even come to Europe and store your data, patient data here inside the EU or in these jurisdictions. So I wouldn't complain about regulations as many people do. There are many help is given to you as a provider, like sandboxes, working with regulators. But if you want to really move on quickly, then the best way is to do pilot in a closed circle, only with your colleagues, only with your staff, and experiment, and then broaden up a little bit the scope and involve maybe just a small part of patients and see how it goes. And there are always solutions. The technology is unlimited now with AI and agentic development. The prices are much less than before, and the implementation times are much shorter. So I encourage everybody to experiment and work around the regulations.
Okay, so just summarize. I mean, you would even say that the regulations, they are not a problem. They can somehow even be an advantage because they make you develop products in the right way. That's one takeaway. The other takeaway is also that you as MedHubAI have, let's say, your special ways of making sure that you can make a safe development, that you can also comply to the regulations, that you, let's say, form the right environments while doing the development process to come up with safe products.
Yeah, that's true. So, and it's always possible to, and during this time, you are free to experiment and do pilot projects, which are not expensive first, quick, and you can have a conversation with regulators and build your system in a way that will be robust and future proof. So it's not like that like in the past, or maybe some people imagine that this is I better do not anything. I don't touch any of my old systems because then I get a penalty. It's not like that. So you are always free to experiment in an isolated sandboxed environment.
Okay, great. And you talked about the technical aspects of developing, but I mean, you also have a lot of concrete and nice examples of how you developed products, and maybe you can talk a little bit about, let's say, the projects, or how that was perceived at the customer side. What were the changes? Maybe 2 or 3 highlights.
Yeah, so we did a bit of research what's happening between the clinics and doctors and how they communicate with patients. And this is always a problem because there is a huge knowledge base and expertise inside these clinics and in the brains of doctors, and there is no time to efficiently deliver these messages and knowledge to the patients, of course, because of the labor shortages, the tight schedule and so on. All clinics and hospitals are overwhelmed. But patients has a need for clear, messages and information about every tiny details, which could be boring for the healthcare professionals like front desk, reception, and doctors, but it's very important things and items for the patients. And we were thinking, hey, why don't we do an AI system that takes this burden away, this stress away from the doctors and nurses and reception desk, front desk, and that's use AI. And then we built some pilot projects, charity projects in the oncology sector, and it worked well. Patients really loved it. They opened up because it's an environment where you are not judged. It's completely anonymous, so nobody knows who you are. So our core product is not identifying anybody. So there are no registration. You just free asking. You are just asking a system. It's not the same as speaking with a doctor, but it's between helping the patients efficiently, but not giving a medical advice. So it's very clearly disclosed that this is not a medical advice. We are here to help you until you get a real human expertise. But in this time, while you're waiting, we can still help with AI tools. It proved to be very useful even for people who are not under stress, maybe who are just planning a heart transplant next year, but they want information, or dental treatments like whitening. These are not stressful things, this is not urgent, but you want to chat with somebody about it without a judgment or any identification, and this is the right tool. And then this platform can be scaled up if there is a wish to even tackling more complex problems.
Okay. And I mean, we talked a lot about the technical side and the development. What I find interesting is also, I mean, of course, the perception on the customer side, on the clinic side. And I see many different opinions on the usage of AI. I see people who are, let's say, very open and say, look, this really helps me to have a focus on my added value or value adding activities. I can focus on the patient. I can make work efficiently in the end. And on the other hand, there's others who are, let's say, strictly against it, not due to maybe GDPR topics or technical topics, but they might rather say, look, Gen AI cannot have the quality, the personality, and it might have a negative effect maybe on the brand or on the perception. And I mean, you had several projects with clinics. What is your opinion? What is their impression? How good is the quality? What is their feedback?
Yeah, this is a very good question, Dirk. I'm glad that you asked. People used to judge by media headlines and 3 years old technology, because there are some chat widget and chatbot companies who are delivering mediocre quality products. But we dig deep into this topic because of the mental health and oncology, psychology. Sorry, I will edit this out. Psycho-oncology area, and it's with the right prompting. Prompting means that you are creating a personality of your responses, so you can create an artificial receptionist or artificial assistant, and you are, as a clinic owner, decide what kind of personality it should have. So now the models are at human level, so this is scientifically proven. So if somebody is interested, happy to share some research papers on it. So we reach the level of the communication level of these models from Anthropic or OpenAI, also from open source. Somebody wants an open source one, is feel free to use it. So the level is human level communication, and the personality, the empathy. Most of the time, Anthropic models, the empathy is the best globally now. So you can get a conversation which is similar or 99% the same as a human conversation. They can feel the intent, they can feel your mood, and they can change the responses accordingly, whether you are under stress or you are happy. And also the knowledge base, back to your question, everything is curated by the clinic staff or the doctor or the leading medical expert, what the model should say and should not say. So you are 100% controlling the responses.
Well, that's an interesting point, actually, because I mean, there's two things I would like to highlight there. On the one hand side, of course, I mean, you have the choice as a clinic to fix the personality of your, let's say, Gen AI front end. So this means it can be really, let's say, customized in a way that it suits to your brand identity, to the way that you want, let's say, people being treated.
Yeah.
And on the other hand side, I mean, you say quality is nearly 99% or roundabout in terms of, let's say, having a partner that talks with you in a way full of empathy and so on. But I think there's one big difference, actually, because I mean, your Gen AI partner always has the same resources. Yeah, your bot is not getting stressed. Yeah, like every one of us. Yeah. So I think that's also one of the big advantages, because you have a, let's say, personality there, even if it's artificial, a personality which works 24/7 at a high level, friendly level, always being ready to receive customers in a positive way, and just having an open ear.
Yeah. That's exactly that. This is very, very important point, and one of our researchers showed that the infinite patience is very assuring for people who are under stress or want information, because they don't feel the urgency that they want to just get rid of me, they want to hang up. No, it never happens. You can have like 2 hours conversation with these bots. And the other thing is that we are measuring the quality, and the clinics, many clinics are working with us, looking at the responses. These are all anonymous, so we don't know who the people are, but we are looking at the quality of conversations, and we fine-tune, we feed it back to the models, and the conversations and everything will be much better with the time. So I would say that first 2 weeks, 4 weeks is a test phase, and then we can go live, and then this system knows your clinic better every month, and all the information that it delivers. Imagine that you have a very complex price structure that people won't understand. You will discover the gaps. Why are they? What's the problem with my pricing table? What was the problem with my campaigns? Why it's not received as I wanted? And looking at this conversation, you can discover the problems and fine tune, and everything will be much clearer by the time.
But that's a lovely thing, because I mean, I was managing clinics as well, and I think this is one topic actually which is always, of course, a challenge. I mean, you want to improve your quality of your services and your processes, but you're very much tied up with the daily work, with operations, with your patients. But I mean, in this case, actually, what you get is a very high, let's say, consistent quality on the one hand side. On the other hand side, you can increase your quality by really improving your Gen AI, improving your front end. And I think this is something most of the clinics cannot do in the, let's say, purely human world, because I mean, what you're really seeing in reality is a lot of fluctuation in the clinics, and especially in admin jobs or front desk jobs, for example, you might have a high fluctuation. And I mean, tell me how the quality will be if you have this high fluctuation all the time. I think that's one of the biggest challenge. And here you can just install a system where okay, quality will be consistent, and it will even grow over time. So I mean, you're not just supporting the front end, you're also supporting the people who have to take care about the patients, but you also support, for example, if there is an HR department or people that need to develop certain, let's say, areas. I mean, that can be really a big relief, because especially for those things where it's more repetitive things and so on, I mean, either you have fluctuations, or the people do it for a certain amount of time and then maybe do a different position somewhere in the hospital. Exactly. So you always have a brain drain, a loss of knowledge, fluctuation of quality as well, and in the end also a fluctuating customer perception.
Exactly that. And this reminded me what you said, that these models can be used to with the time to train on your clinics how they handle problems, issues, and that's the same platform can be used to train the new people. It can be a kind of a co-pilot while they are taking calls on speaking with people, and they can ask that a new person during the onboarding can always chat with this platform, that what should I reply, what's the process, what's the protocol in this hospital, because we've got the 2 years of conversations in the brain of the the hospital's AI. So if as you grow, as your clinic or hospital grows up and employs more and more people, this can be a central truth, like one source of truth, and you can train your new people. The other thing is that what I wanted to say, that if you want to upgrade, you can have a system that identifies patients and knows everything about the previous conversations. That can be solved, or GDPR and HIPAA or whatever compliant way. You can build a system which runs inside your building, so in the local servers if you wanted to, but you can ask patients to log in. And by logging in, they get a much better service, because we know the history, we know all the diagnosis, the previous treatments, and so on, and the bot will be much more relevant to them, personalized responses.
Okay, what do you think? Maybe the bot could even be like an alert system internally, in terms of, I mean, if there is specific contraindications or whatsoever. Of course, I mean, there's a protocol. But I mean, if specific things occur, or specific, let's say, problems or an allergy is popping up, or let's say specific health conditions, I think that can really help also to improve the patient journey, or give a
Absolutely.
more, let's say, personalized approach. Because I mean, what I've learned is also that I mean, sometimes the patient data is around, yeah, but it's maybe not available at all touch points where it would be necessary
Yeah.
from different areas within the hospital or clinic.
Yeah, yeah, exactly. Yeah, yeah. You exactly now created a new feature or a new product. So it's as you can see while we are speaking and discussing, there are new and new ideas popping up. So
Yeah.
this is a different mindset now with AI and agentic development, that since almost every day you can have a new idea and that can be
Yeah.
implemented quite quickly
Yeah.
for your clinic, and you can find out new features as a clinic manager or clinic leader, and customize your platform. Dirk, in your experience in the last decades working at the healthcare sector, what was the most challenging field?
The most challenging field. Wow, that's a good one. Um, I think the most challenging field is and will be to have, let's say, efficiently running um, patient care and patient outcomes, because it's such a joint effort. I mean, I've seen many different healthcare systems, and I can say that it's very complex. And I mean, you being in the UK know how complex the NHS can be, for example. And there's huge challenges. I mean, there is a huge cost challenge. The costs for health are just skyrocketing. And then on the other hand side, of course, you need to digitalize and make your processes more efficient. On the other hand side, it also needs to be regulated in the right way. So there is a lot of different factors playing in. And then, of course, you also have industry interests. You have topics which are really absolutely trending and important for the future, such as genetic testing, prevention, and personalized medicine. All this is also somehow interwoven with topics like, okay, how to automatize processes, how to use data. And yeah, I think this challenge is still going on. So I found it most challenging really to make a big change in markets that really helps um, a lot of patients. Of course, there are always innovations in the field of medtech, which is nice, and of course, then there might be quite specific new technologies for operations, for example, and this is something really great. But still, I think we're struggling with some basic things also in Europe, like there's so many people having ulcers, yeah, because there's a lack of interdisciplinary work, and you need to have, let's say, people from different fields working together,
Yeah.
having the patients referred to the right places, and I think that's the biggest challenge for all of us, be it on the industry side where I've worked for 20 years, but also for policymakers and also for the people who make, let's say, the processes more efficient, like MedHubAI or Reuter Medical now. And I think, therefore, also it always needs education. It needs an exchange of knowledge. I think this is also why we are doing this interview, why we're sharing it. And this is, I think, also why we found together. Because if you want to make a change in healthcare and want to make things better, you have to come from different sides. It's not just good to say, look, we have an AI tool that's working, or it's not good to say, okay, we have a medical product that has a special feature. I mean, it needs to come together with the need on the customer side. It has to make lives easier, has to make processes easier. It has to save costs, have to make the clinic or the institution where it's used that more efficient. Yeah. And I mean, one of the biggest challenges always is, there's a lot of people who need care, but of course there's also a certain shortage in labor.
Always,
In some fields, it's really very predominant. And without more efficient processes, this can actually not be overcome. And we will still face backlogs. We will have people who might find it difficult in the UK to have their ulcer treated, and these are countries where the healthcare systems are developed very far already. Yeah, so. But I think it's a big chance for all of us. I think the usage of AI might be a real game changer in making healthcare more efficient.
Yeah, there's many people say that this will save the world from collapsing if we delegate the basic foundational task to AI, but even the R&D research partly with a human orchestration, so it augments and elevates human doctors. And I remember one of your first questions about the global differences, and we stuck with Europe. We didn't discover you have a lot of experience globally in different regions. What did you notice?
Yeah, absolutely. I mean, one of my absolute favorites is the Middle East in terms of adaptation of some technologies. I mean, they are very open, and I think they're very, let's say, state of the art, and it's part of the culture. Yeah. So it's already beginning, let's say, with the usage of social media, and ends with the adaptation of new medical devices, or the usage of AI in the OR, also for diagnosis and other things. I would say China is also extremely developed and very pragmatic also. But I think the good thing is also that we sometimes have different regulations, different cultures, and I think there is definitely there's a little bit competing systems, but on the other hand side, I think this will also show what works out best. And of course, there might be some trial and error, because I mean it's a field where a lot of things have not yet been discovered.
Yeah,
where you maybe just find out about the complexity while doing so. So I think the topics we talk about, like front-end solutions, they already have quite some complexity. Yeah. But still, I think they're handleable, and there's very nice tools for that. But then when it comes to integrating these tools and kind of connecting the loose dots, I think that will be also an interesting transformation phase that will, I don't know, take many years, because there's so many valuable data that help to manage health in hospitals. And at the moment, I think the companies, the industries, they're coming from totally different angles. I mean, we're coming from the process side and have a look at the front end. I mean, others, they are coming more from the diagnostic side, others from the scientific side and data management side. And all this at a certain moment in time might be interconnected and might really bring things to a totally different level.
Yeah, exactly. I think the miracle is when multiple experts working together, the holistic team, even just two, one technical person, one doctor, because together they can be much more efficient, and they can create something new that they wouldn't be able to do alone. Like, let's say that a developer sits down with a GP. A GP has like say 40 years of patient experience, and the developer has 10, 20 years of coding experience, and they could build a real magic together, because they both add the expertise. And it's fantastic to see sometimes these kind of projects. In your experience, how about these software and systems, sometimes legacy systems running at clinics and hospitals? What's your experience, and what do you think the solution could be to upgrade them? Not necessarily replace them, but a little bit of adding some digital transformation to them.
I think it definitely has a lot of potential, but first of all, we should ask the question, why does it come to legacy systems? And I think on the one hand side, there might be a shortage of funds in order to get, let's say, the right systems, or let's say newer systems in place in some healthcare systems, sometimes especially in the public sector. And then secondly, you're not in an IT environment. So sometimes when you talk about smaller clinics, for example, it can be quite a challenge and effort to establish a clinic management system, for example. And once you've done it, you're happy you've done it, you go back to your patients and to your operational processes, and forget that you're also having a clinic management system that needs to be updated or exchanged or whatsoever. So this creates legacy systems. And that makes it, I would say, more difficult sometimes in medical settings to go further and to develop it. But on the other hand side, this also then creates, let's say, a lack in competitiveness, and it creates a big need to really do something.
Yeah.
And then, Bence, I think it's really important to think about, let's say, how to use your clinic management system in a way so that it can interact with Gen AI, so that you have the possibility to get patients' requests data, or that the patients can request data, maybe with the login or whatsoever, 24/7. Why not? It will improve your service availability. It will improve, let's say, your knowledge about the patient and their journey, and
reduce costs.
Let's say, lose your patients. Yeah, it will save you a lot of money. And make it much more easier to have a good service level.
So you mentioned these legacy systems, that they are quite rigid and holding back the hospitals and clinics. And I would like to ask your opinion about smaller shops, like a dentist with two member staff. They might have a booking system already. They purchased, let's say, 10 years ago, and we can call that a legacy already, because patients would expect that you open a chat window and you say, I want to have an appointment next Friday, let's say, and the system should browse through the database about available slots and give back the answer. Instead of this, according to this research we did in Europe, most of the time you need to fill in a rigid, outdated form, which was very fashionable in the 2010s, maybe. But 2025, patients expect something much more smooth and human. Would you agree on that?
Yeah, absolutely. And I think even these smaller clinics or practices, they will largely benefit from it, because it's not just the appointment, it's the intake of the customer data. It's also processes which are shortly before the dental intervention, where you might ask for, I don't know, allergies and or whatsoever. All these things you can really work on them in a very fast and frugal way. And in that sense, you will be really have, let's say, all the resources for treatment and for creating profit concentrated on where you can do it, and not on all these admin work. And especially the smaller practices, definitely they are among the biggest winners, because also the systems that we're talking about, also the front end solutions that you have developed, they are absolutely affordable, and they definitely give you a return on investment in shortest notice.
Yeah. It's I always say to everybody, and that exactly that the mindset shift is changing, and if you have an open mind or experimental mindset, then why not start a pilot project and experiment on that? We are moving away from the rigid solutions that one size fits all. All these monopolistic big companies had, like you had it as a clinic owner or hospital owner, you had maybe 5 manufacturers software products that you could buy. But now, with this new era of AI generated code, you have the choice to have a complete customized system for your clinic, and it's not a huge investment, and everything can be tailored around you, around your patient, how you handle, all the cultural differences can be tackled, because we don't want somebody to import the American or the West European habits and workflows. But you can say, okay, I've got a clinic in Malaysia or in somewhere in the Middle East or India or Japan. I need a totally different solution. I need different communication style. I need different forms, intake forms. I need different responses because we are all different. And obviously, many cities. That's a good topic as well, because that's what I hear. There are expats and migrant workers and
Absolutely.
everything is changed. And in Europe, for example, it's not possible to most of the time to get a multi-language support. In the US, maybe Spanish is supported, but that's all. But with these systems, you could be a tourist, or you could visit your children living in the US or living in Switzerland, and you could chat with the local GP in your own native language. Let's say that you are a Japanese mother, your son is living in Zurich, and you have some sickness, and you could chat in Japanese with the local Swiss dentist, for example. And this is possible with the new technology, and the language barriers go away. What do you think about that?
I think it's great because it makes healthcare more accessible. I think there's many cases, and I mean we have millions of people who had to leave their homes due to the war in the Ukraine, in Afghanistan, in Syria, and many more. And I think one of the most important things of a working healthcare system is that it gives equal access. And I think this is something that AI can really help to create, because language barriers might be deleted to a very high level, because then, I mean, the processes are being understood. People are less fearful doing something wrong while going through this treatment process. So I think that's definitely something where AI helps to have a better integration and a better access to healthcare.
And and it shows that AI is very, very useful and very human if you think about all the topics we touched on, and it's not just for cat video creation for TikTok. You can
absolutely
you can use that.
Although the cats are cute, I do agree, but and Bence, we were talking about also smaller practices, and I mean, especially for smaller practices, I know a lot of them and I've worked together with a lot of them, and actually what I see is also that sometimes due to a lack in the administrative functions, a lot of sales is just being, or a lot of profit is just being lost on the way. And this begins with, let's say, people not showing up because they were not made aware by push messages, by AI, or let's say push messages that might be automated in a different way. And it's the smaller things, But for a business, let's take a physio clinic, for example, with, I don't know, 3, 4, 5 people working there. If 10% of your appointments are not showing up, this is really damaging your result, and maybe you cannot level up your business to the next level.
Yeah,
because you're just missing this, let's say, hygiene factor that takes care that the right people are there at the right time. Or sometimes even there might be some logical mistakes in the booking that occur, and then the right practitioner is not available when the person shows up. Not to speak about waiting times, unclarities, dates and schedules, appointments that have been made on the telephone with misunderstandings, also maybe due to the language barrier, or because maybe there's a human mistake done by the front desk staff, and all that can really, ruin your profit, ruin your your overall result a lot, and might even lead to problems that you cannot, let's say, I don't know, invest into people, have enough people, because you would have the clients, but you cannot retain them. Yeah? Follow-up appointments might not be made because of a lack in these administrative functions. So especially the smaller ones, I would say they're really profiting a lot.
That's a good point. I mean, all of them are good points, but this is exactly in the white paper. The research showed that the post treatment communication is very a problem for smaller clinics, so they can't keep up. And you know, all these patients, if we speak about private sector, they might just switch to your competitor who is more responsive. So with these AI tools, you don't lose as much as clients, patients, as you would do with the traditional ones. In your experience, can it happen that there is a very small clinic, one solo dentist or plastic surgeon or all these beauty industry, they might work in a way that they can't afford assistant or receptionist or front desk because they are on a minimal budget or just they are starting out, and they are treating patients and they can't pick up the phone, they can't respond to WhatsApp emails, and it could be this. Is it realistic?
Yeah, absolutely. I mean, just going to the field of physiotherapy, sometimes the people are very specialized. They might be specialized lymphedema therapists, for example, and they might be working as freelancers, might be working on their own. So they really run 360 degrees of the company, and of course, I mean, they could also extremely profit from this.
Yeah, it's the same as with other trades, that while you are working, you are losing new business. I can imagine that it's very similar, and AI tools can help you out during the time you are fully concentrating on patients. Your phone is not ringing, or you just ignore your phone because you are sure and calm inside that my AI assistant will respond to everybody.
Absolutely, and I think this is something which is, let's say, not really looked at so much. I mean, if you build up your own clinic and maybe you're a startup and you're 1, 2, 3, let's say, physiotherapists or let's say specialists working on something. First of all, what you do is you build up your customer, your patient network, try to get referrals, and then you start working. And then, I mean, there's a lot of them who work 12, 13 hours a day, and then, I mean, some things, I mean, as you said, while working, you lose the customers. And it begins with very mundane things because, I mean, it might be even, let's say, that you don't update your web page, you don't have the right keywords, you don't do your update on WordPress or whatsoever, and the speed of your internet, of your web page is getting slower, the ergonomics is not good, you don't find the button at the right place, and this seems like something really mundane, but for a small clinic, this can really break your neck, because if these hygiene factors are done in the right way, there will be 10 or 20 more patients coming in just by, let's say, little tweaks that you do, let's say, on your homepage. But now imagine, okay, you have a system at the front end which really helps to have a very smooth process, a very professional process. So, I mean, you just contact Bence's physiotherapy practice, and you just directly get an answer afterwards. You might even ask something a little bit more specific or, let's say, treatment related. You get an answer.
Exactly.
And this differentiates them from all the others who are struggling because they are working with a patient, which is good. But if you don't, let's say, look at the front end, you will just lose your customers.
Yeah, this remembers me to my time as a young graphic designer. It was feast or famine because I was looking at the computer screen. The new business were not coming in. And why I was the same when I was going into town to meetings, building new business, the computer was cold and nobody was progressing on the project. So with the AI, you can handle much more. And
you can balance it out,
balance it. I mean, obviously not perfect, but you can go up to 90%. It's much better than zero. And these tools can capture your new patients because they can leave their names, their phone numbers, and after work you can call everybody one by one. So it's a capture tool. So new intakes. Yeah.
Yeah, and I think it's interesting for me at the moment. You know, I'm also a patient. I go to dental clinic, for example, or I mean that is not the medical field, but as an entrepreneur, of course, we have a lot of suppliers and people who also have, let's say, their Gen AI front end to us. And I see there's really different qualities and let's say also different, let's say, marketing approaches behind it. But for example, my dentist, so I go to a Swiss chain of dentists, and they have the perfect, let's say, patient information system for me. Yeah,
right.
So it's very clear. I never wait there. It's fast. I get a reminder because I would also be a candidate. My schedule is full to just to oversee and not come to be a no-show. So that also helps me a lot. And I can really see the people in the clinic, they are really friendly and happy to me. It works out very well. Yeah? And then I see some others who have, let's say, not Gen AI, but automatized processes with a lot of, let's say, spamming information actually afterwards, where I just get annoyed and always get push messages also on as SMS per email on different accounts. And I think there's different qualities out there. What's your impression? How is it in London? How is it for you as a customer?
Yeah, it's a good point because I am split between Hungary and in the UK, and what I see is in the Hungarian market that they are increasingly using SEO, different marketing channels to reach patients and keep them. While in the UK it's not, it's more regulated, or maybe I'm not very familiar with the NHS kind of protocols, but it's much more strict how you can advertise to your patients. It's similar, but in the US you can advertise solicitors and lawyers, but in Europe it's forbidden completely. You see the big posters in the US with divorce law and so on. I think it's a question also on regulations, how much you can reach, how much you can communicate with your patients. But with AI, it's I think it's a very good tool or channel because it's not direct advertisement. It keeping in touch. It's a open communication 24/7. So you always notice I have my doctors on my phone 24/7 for me. Anytime I can go there and ask questions. So you are not relying always on Facebook or Google Ads and direct messaging services. Yeah. So Dirk, in your experience, you managed clinics a few years, and you did many things in the last 20 years. What would be the ideal way of implementing an AI pilot project or experimental thing?
Yeah, I think, Bence, that's quite clear. I think you always need an interdisciplinary approach. So I mean, this is also why we're partnering up. I mean, you need somebody who's really strong on the let's say on the IT side, on the development side, which is you as a partner as MedHubAI, and the other side is of course somebody who really understands, let's say, the patient side and the clinic side and the requirements on the processes. And the second thing is to do a due diligence really at the beginning phase to really know, okay, what is the brand identity, what are the values, and the digital strategy behind this implementation. And I think this is also something where we consulted Reuter Medical to define this strategy in order to implement something sustainable, not just a fancy tool in order to have something with Gen AI on it. No, it needs to be something sustainable that fits into the philosophy and also into the let's say, to the values of the company. And I think this is the good thing, because together we can really individualize this in a way that it suits to any clinic.
Yeah, that's a very good response. And if I had a clinic, I would approach it in this way. And what I would add is, this pilot and incremental kind of software building process is coming from Silicon Valley. I don't know exactly how many years ago it started, but it worked really well. Lean processes. So you always do it step by step, and you test early. So you are reducing the risk almost down to zero, and reducing the cost as well, and you approach in this way. So you are not purchasing €5 million software and then see what's happening. So you are just a fraction of the investments you needed, and then you add features one by one. So this is from the technical perspective, it's incredibly flexible. It's undoable. So I wouldn't say that failures won't happen. You need to fail sometimes to get ahead, and that's the beauty of experimentation. You can always pivot. If something is not working out, then we can almost for free pivoting to another direction, and that's how it's working. And the modern clinic owners recognize that, and borrowing this kind of lean processes from Silicon Valley, how to progress quickly, cheaply, efficiently. And we are talking about patient-doctor communication, and this can be always fine-tuned. It can happen that sometimes the AI response will not be the best quality, what you expected, but we learn always from that. That's why we monitor the conversations and we fine-tune it, and next time the AI won't make the same mistake, which is not guaranteed if you have human workforce, because they might do the second and the third same mistake during the opening hours. So in a way you can build a kind of an intelligence which is different from human workforce, but has the advantages. I don't know if it makes sense.
Absolutely, absolutely makes sense. Absolutely makes sense. And I think the good thing with the approach is that you really, let's say, develop something with a partner step by step, with, let's say, a minimization of the risks. But also, let's say, while trying out what works and what is good, and this embedded, I would say, of course, in a, let's say, clear digital strategy.
And in your practice or experience, how do you usually measure return of investment in a way as startups or really Fortune 500 companies measure, or how is it in the healthcare?
I think this is a quite easy question, because you have at the front end, of course, you take care of your customers. You take care of, let's say, keeping them in your funnel. Or afterwards, you you take care that you retain them. By making sure that they will come to the next appointment and be compliant along their customer journey. And this you will just see right away in terms of appointments, treatments, and you can put, of course, a profit tag behind all of that. And I've seen that it pays off quite fastly, because what we're also doing at Reuter Medical is we're helping clinics to increase their funnel, also, for example, by helping them to improve their social media strategy, their digital strategy. And this is something you see very, very fastly.
Yeah, that's a good point, because analyzing the conversations, the AI engine can give ideas for social media strategy campaigns. So you have a second opinion from the AI. How should you do the strategy?
On the one hand side, you get more customers in because they don't get frustrated because they don't get an answer and go to some other clinic.
Yeah.
You retain the customers, but on the other hand side, you can also use the intelligence and the questions that are posed there in order to feed your, let's say, social media selling side, yeah, and your marketing side, because you really get the customer insights. You get the topics that are trending, you get the topics that are working well in your clinic, you get the positive and the negative feedback. So it helps you to improve your clinical services, but also your communication.
Yeah, exactly. And it's most of the time is neglected or ignored because too much stress during the day.
Yeah.
With these systems, you can measure it quite quickly. So you have the metrics, and you can test. So it's part of the pilot project, and this incremental step-by-step building that we should always measure what are you getting. So we are not building something that you don't want. Usually, if you buy a rigid package from a big provider, you are paying for features that you don't really need. But this is one package, and here it's possible to really build something that only you need personally. Yeah.
Okay. Yeah. That's cool. Yeah.
The demand for patient care is 24/7, but your staff can't be everywhere at once. The administrative burden is real, and it's holding you back. It's time for a new approach. What if you could provide instant, compassionate support anytime, anywhere, all while reducing your team's workload? Introducing MedHubAI Pro. We've built an advanced AI platform with 3 distinct assistants to revolutionize your patient communication. From answering initial inquiries to providing emotional support throughout a patient's journey, our AI delivers personalized, expert conversations based on your clinic's knowledge. For private practices, GPs, and specialized clinics, it's the key to enhancing patient satisfaction and retention. MedHubAI Pro, always on, expert AI that empowers your patients and supports your staff. The intelligent heart of your practice.